Gaming disorder is listed in the Diagnostic and Statistical Manual of Mental Disorders, or DSM, as a condition that needs to be further researched and classified. It also lists the 9 traits that are used to diagnose the disorder. Here are the 9 traits you need to know. Dr. Joseph, in the DSM, the Diagnostic Statistical Manual that we use to get all the criteria for every single mental health disorder, video game addiction is not specifically listed, correct?
It's listed under disorders to be further researched and to further classify.
Okay, so is there diagnostic criteria attached to it?
There are.
So we follow that when diagnosing video game addiction?
Correct.
All right, what does that criteria look like?
So you have to have 5 of 9 symptoms for at least 12 months in order to be classified as having a gaming disorder. So the first is having a preoccupation with the game so that it just detracts you from everything else in life. The second is building up a tolerance to gaming. So you have to game more and more in order to get the same type of thrill. The third is developing withdrawal symptoms when you stop gaming. So you actually have physiological agitation, anxiety, depression. The fourth is losing interest in things that you typically were interested in, but you're no longer engaging in them. The fifth is lying about your gaming because you don't want people to know that this is a problem when it really is a problem. The sixth is engaging in risky behavior. So when I say risk, that one can be confusing. Basically, you're taking a risk when you're gaming because you know that this is creating a problem in your life and you continue to do it. The seventh is jeopardizing your successful areas in life. So jeopardizing your academics, working, your social life, your family life, because you continue to game even though you know that it's a problem. So the eighth one is using the gaming to replace feelings of inadequacy, loneliness, depression, feelings of guilt. And the ninth one is a lack of complete control. You're trying to stop, but you can't.
And you have to have 5 of those 9 or more for how long again?
For at least 12 months.
For 12 months. Wow. So this is a relatively slow creation, I guess, of addiction.
And that may change because, as I mentioned, this is a new disorder. It's not even in the main part of the DSM-5.
Right. Now, when you see a client, how do you test them to see if they fit this criteria?
So there are great online tools. And there's a book by Adam Alter, who works at NYU and who's one of the premier scientists in this field. And he lists them all out in that book. So you can go to Psychology Today. They have an online screening test. You can go to the Restart program, which is one of the major inpatient programs in this country to deal with severe gaming addiction. Wow. They have an online test on the website. And there's also a doctor by the name of Kimberly Young who developed the first internet addiction test. And she has, I believe it's free and available for parents if they want to search online. But she has a classification where if you score below a certain amount, you don't have a disorder. And then there's mild, moderate, and severe, based on the scoring of that test.
So when somebody comes to see you, you're going to administer one or more of these tests?
Correct.
Now, what if the child's 6 years old? Does it still work for them?
So the parent fills out the test.
Oh, no matter what. So anybody under the age of 18 is going to have their parent fill this out?
Correct.
Now, to me, that seems a little weird because a 17-year-old is almost an adult. Wouldn't they be able to fill out that test?
If they don't want to.
If they would have to want to.
What are you going to do?
Right,
yeah.
right. Now, what if the person's 23 or 33 and they admit they have a problem, they're there, then they fill out the test?
They can fill out the test.
And you find these tests to be very accurate?
Yes. And I use tests in other diagnoses. I have tests for ADHD, for anxiety, for depression, for bipolar disorder, for OCD. Because what we find is that when we speak to kids and we ask them about their symptoms, sometimes they're not as forthcoming. Remember we talked about lying as being one of the symptoms? So when you give them a survey, sometimes it's easier for them to answer using the survey because they take tests at school.
Right.
It's less personal. And this generation, they're more accustomed to answering things using devices or forms compared to face-to-face. Yeah.
Do you still follow up with a in-person conversation with them?
I do.
Okay.
And usually I administer a test before I meet with them. That way we can discuss it. Because if you have someone who's not really willing to admit that they have a problem, yet their scores are off the chart, it's something to talk about in the session.
Nice. And in these sessions, we'll talk in more detail in our next episode, but in these sessions, it involves the parents and the child?
So usually I meet with both first.
Okay.
I explain how the meeting is going to go, and then I meet with the parent or the child first, depending on the situation. If I have a child or a teen who doesn't want to be there, I'm going to meet with the parent first because I can anticipate that the teen doesn't want to talk to me, and then I'll meet with the teen. So you have to be flexible.
It is really great to hear, although there's not a lot of studies and research on video game addiction and we need more, I like that there is at least a criteria to follow so we're all on the same page so we can get the right diagnosis. And if we get the right diagnosis, that means we have a better chance at getting the right treatment. In our next episode, Dr. Joseph outlines all of the different treatment options for you or your child who has video game addiction.